CTV News at 6 with Hudson Mack.
Good evening. We begin this hour with more on seniors' care and seniors' dignity. Do you wonder about the care your elderly parents or grandparents get? How many times a week should a senior be bathed, and how often should there be assistance to provide them to use the bathroom? As it turns out, there are no policies on that. Those are among the findings in the report from BC's Ombudsperson, the report that jolted the province into taking action yesterday, announcing the appointment of an advocate for seniors. And tonight, the woman who wrote that report some time ago is speaking out. CTV Legislature reporter Stephen Andrew has the story. He joins us now live outside the Legislature with more. Stephen.
Hudson, the BC government says its action plan for seniors is going to deal with many of the issues that the Ombudsperson has uncovered. But the question is, how long is that going to take? The Ombudsperson's report is an often disturbing examination of how some BC seniors are being treated in residential care. It highlights a lack of standards for a number of everyday functions that many take for granted. Some of the findings: healthcare authorities have no policies on how often seniors get a bath. Access to dental care is inconsistent, and help getting to the bathroom is often scheduled at specific times, causing one elderly woman to soil herself because she simply couldn't wait until her appointed time.
We heard from a facility operator who said if there was one thing she could have, and it may sound like a very strange dream, is she would have a team devoted to toileting, so that she could have people who were always available to assist seniors, because it really is a very basic part of dignity.
However, Kootenai West.
The opposition is seizing on Carter's investigation, accusing the government of not doing enough.
The Ombudsman came out with a scathing report that clearly shows the Liberals had failed on almost every front in seniors' care.
Is it fair to say that there has been somewhat of a store and ignore model going on here?
What I would say is there hasn't been a focus in this area, and the kind of things you see here are the kind of things that happen when you have a period of time when people are not paying attention to an important issue.
The government says it is paying attention and its action plan will help.
We're going to move very quickly on this. I'm certainly keen about it, and you're going to see action.
Carter is hoping for more response, pointing out the government hasn't moved quickly on her recommendations in the past.
Our recommendation in 2009 about more information, that seems to be the first focus, so there may be progress in that area.
So it's taken them basically 3 years to get the message.
What I would say is we're polite but persistent here.
Polite indeed. The government received Carter's report 4 months ago and only responded to her findings yesterday. Now, of the 176 recommendations in this report, Hudson, one that really is causing some concern for the Ombudsperson, and that is how health authorities restrain their patients, whether they tether them to the beds or whether they put keypads on doors to prevent them from leaving or even drugging them. The Ombudsperson says he wants the government to quickly deal with an investigation they're doing into the increased use of antipsychotic drugs and make that report public as soon as possible. Hudson?
All right, Stephen Andrew reporting. Stephen, thanks.
You're welcome.